Jesus!
This lady.
In March of 2024, media personality Jacinta Ngobese Zuma gave birth to the March and March protest movement, a non-government organization to agitate against illegal immigrants being employed in South Africa. The movement has now spread its tentacles beyond KZN, with presence around the country. Lately, the movement has heightened its radical approach, encouraging its volunteers to block hospital entrances, vetting those who enter the facilities by verifying their IDs. The behavior of March and March has been condemned by several health MECs, not least the KZN Health MEC Nomagugu Simelane Mgadi and the Gauteng Health MEC Nomantu Nkomo Ralohoko.
This is a painful situation because our people need services, but we have this burden of other people then that have to come from other countries. But the issue is we can't chase them away when they are not well because the constitution don't allow us to do that. And people want us to flout that process. What we have to do is this issue of local health prevention programs that we can do, because if we go to communities and make sure that people don't get sick, they prevent the diseases. That's why we even have now programs like your household food gardens. It will help us to minimize the pressure that we have in our institutions. Then we'll end up not even fighting amongst ourselves as Africans, because the other issue that I always say, why are you fighting these ones? Because they are staying in the township. You can't identify other people who are not staying in the townships because it's not easy for you to know that this is my black sister that is coming from another country, which is abroad, because of the color of the skin. But these ones, it's easy to be targeted by us as the South Africans. So for me, I don't agree. And it's a painful story, but unfortunately, people feel that we're not supposed to do that. And if my worry is that if that person dies at the gate of the hospital, no man must stand there and clarify the citizens. What will I say to the citizens if a woman was heavily pregnant and that woman was denied access to the institution? That woman gave birth at the gate and that child, including the woman, died.
In Durban, tempers are flaring. Durban resident Crispin Hemson, 77-year-old, a former director of the Center for Nonviolence at the Durban University of Technology, alleges he was violently assaulted by members of the March and March movement at Addington Hospital after he refused to provide his ID at the hospital's gate. The incident took place on Thursday outside the hospital's gates, where the group has been stationed for weeks, demanding IDs from individuals they suspect are not South Africans.
I'm Crispin Hemson. I'm a citizen of Durban, 77 years old. I had to go to Addington Hospital twice recently. I was trying to get a surgical appliance form, which I got yesterday with the help of the really nice people in physiotherapy. But when I went the first time, there were people at the gate. Finally, I realized they were March and March. They insisted I produce an ID, which I refused to do. I don't show my ID to people in the street. They have no right to ask me whatsoever. So they were very angry with me and they were lying to me about the Constitution. They claimed complete nonsense. They said it was in the Constitution. The Constitution makes it clear that no one can be denied access to health services. So when I went yesterday, I realized there was a group of foreigners. I actually spoke to them before going in, and they showed me their documentation. They documented foreigners and they'd been denied access. When I tried to go through, these people obstructed me first, and then when I tried to go through again, they began pushing me around, knocking me around, as you can see on the video. I managed in the end to get in, but only by phoning SAPS. They had to send a police van to tell these people that I could go through, which I think is ridiculous. Just my basic right to enter a hospital. And when I went in, one of these people said she must go in with me because I was going to collect medication for foreigners. I wasn't. I was there to get this form. After I had this experience, I went to the police, SAPS, the Point Police Station, and I was entirely obstructed. I said, I just want to lay a charge of assault about what happened. And they they just said, no, you're not allowed to. And whenever I tried to speak, they said, literally, no, 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 we're not going to listen to you about this. The detective said to me, oh, we will take action when the Minister of Police tells us to take action. So I said, so when there's a housebreaking, do you wait for the Minister of Police to tell you what to do? This is a violation of the law. They should not be allowing it. I think that this is something really sinister. It's entirely anti-democratic and authoritarian. Nobody has the right to set themselves up as our boss, whoever you are. And if there'd been a group of white people standing there saying we only let black people in, they have no right to do it. These people have no right to do what they're doing. There are South Africans, significant number of South Africans who are being denied access because they don't have an ID, didn't come with an ID, or like me, refused to produce an ID. There are South Africans who are born elsewhere who are being denied access because they were once a foreigner. It applies not only to foreigners, it's a knife at the throat of all of us.
In a statement, the March on March movement said it was appalled and gravely affected by the incident. The group claimed that Hemson was swearing at them, unleashing explicit racial slurs and physically manhandling and inappropriately touching the woman, whom they said was a volunteer at the hospital. They also claimed Hemson was collecting medication for foreigners. This deeply disturbing incident is reported to have occurred recently, with similar racist and aggressive actions by the same individual observed as early as July 10th of 2025 at the same location. Such actions not only undermine the established legal frameworks governing the healthcare and immigration in our country, but it also contributes to a climate where lawlessness and discrimination can prevail. Furthermore, the harboring of illegal foreigners is itself a criminal offense, movement added.
IOL has reached out to the KZN Department of Health for comment, but they will not comment on the matter.
The police response regarding the matter of hospitals being blocked has been rather mute. IOL sent the police a list of questions, among them, why are police allowing March on March to act with authority at public hospitals by demanding identification and denying people access? KwaZulu-Natal Police spokesperson Colonel Robert Nchunda did not respond to that specific question. He did, however, deny Hemson's allegations, but he would not provide further details to substantiate his denial. He simply said, "We do not respond to allegations." He further added, as for the claim that detectives at Point SAPS refused to assist him, that's not true. There are no detectives stationed at the charge office.
The March and March movement have not denied blocking the man. Having been refused entry, Hemson said he then proceeded to the Point police station to report the matter. However, he claims police refused to file an assault case, although he admits they did escort him back to the hospital where he was then allowed entry without producing the ID document, and he obtained the surgical appliance form he had been to retrieve at the hospital. Hemson has been a vocal critic of the March and March movement. A number of posts on his Facebook account show. A few days ago, Hemson wrote, open quote, "On the issue of those blocking admissions to hospitals, I do spend a great deal of my time on the complex issues facing black South Africans who have no money. There's a pressing need for a more viable economic system that addresses the lunatic inequality of the society. The way our politics works is to construct one or other group of poor black people as those to blame for our plight. The pressure on people is not to unite against the wrongs of our society, which would mean exposing those who benefit most from the corruption and exploitation, but to gang up on one another or vulnerable group. Dividing black people against each other was at the core of colonialism and apartheid. Yet, that point is still being ignored. One example was hearing from some of my students who are migrants from Eastern Cape talking about the hostility they experienced at university, of all places. Yet, when I asked my students, a high proportion had come to Durban from distant places. Fundamentally, targeting black people who have come from other countries or from other parts of our country is entirely about falling into the trap of division. Of course, migration is always difficult. Cities struggle to cope with the influx of people, policing what is legal is really difficult, and corruption undermines attempts by honest officials to manage effectively. In the end, though the active xenophobia I encountered is a knife at the throat of all the vulnerable, South African or not, every xenophobic uprising in KZN has done damage, least to the wealthy and most to the poor. We should never tolerate it. Any of us going into hospitals should refuse, in principle, to cooperate with the thugs who have set themselves up as the gatekeepers. Close quote. It is undoubtedly a matter of heightened public concern, public interest, and public health. Have your say in the comments, subscribe, and stay tuned to iol.co.za for more on this saga and other current affairs matters.